Good morning. Today we have in our studio Dr. Parimala Devi, attached to Foster Hospital and Parimala Healthcare from Bangalore.
Yes.
So welcome, Doctor, and a very warm
Thank you.
welcome to you.
Thank you.
So, Doctor, today we will be talking about a few things about anemia. So, we would like to know your view on certain specific things like mortality in anemia. So, Doctor, what is your opinion or your view on mortality in anemia?
See, Dr. Ashish, anemia is one of the killer. However, we have technologically and we have advanced in our medical treatment and managements. But anemia is still the basic thing which we are unable to catch up because it's bringing lot of mortality in our women. Maybe it is said and this one, even though we speak, oh, it has come down and all. But when we go to the deeper aspects of anemia, still it is killing lot of women. Because it's the ignorance of our women, and even though it is reachable, especially our rural population women, pregnant ladies, they hardly take the services, all those things. For example, the mortality because of anemia. Anemia as such, it may not kill the woman, but when it comes to the bleeding, when they deliver, and when they get into these gynecology, bleeding problems and all, they are subjected to more and more cardiac failures, and they will die because of the heart problems, because anemia will definitely bring down their capacity to breathe because the oxygenation in the tissues is reduced. Why this is happening? Why the mortality is still so high? We have lot of iron preparation. Go to see morning and evening, we are bombarded in our clinic with lot of iron preparation. Come to any company, basically they will have one iron, one calcium and protein. But the oral iron, what the tablets we dispense, usually our women take 1 day, 2 day, but the compliance is not there because of it. Sometimes the gastrointestinal effects which goes on. They may have vomiting, they may have constipation, so many things. Because of that, usually they will give up on the oral preparations. Then like that only, even the protein, along with the iron we give protein, but protein also sometimes not palatable, the taste of the protein, then they usually give up. Because of this, they slowly get into anemia. In the pregnancy, the demand for hemoglobin, the iron is so much. It is requiring about 160 to 200 milligram per day. They will not take it even in the diet. They may be by economical status or by their fussy nature, they may be very poor in their dietary intake. So because of that, they will get into anemia. So how do we go about this anemia? How do we bring down the mortality? Because a country is always measured in its health profile by their women health and also by their child health. So a mother and child unit will represent how healthy is that country is.
Absolutely.
So that's
absolutely
anemia.
Correct, ma'am. So according to you, the iron preparations should be the foundation stone for treating anemia.
Yes.
So how do iron preparations play an important role for the treatment as such?
See, I am actually, my practice in this field is about 32 years now. Since 1985, I am practicing obstetrics, gynecology, more into the, of course, colposcopy, that's the cancer prevention program. I have seen lot of iron preparations being coming and going from the market. I have seen the IV irons as back as nearly about 30 years ago. That was the time the IV iron started. I am in that full bloom of that iron preparations taking its revolution in the market. We would sit in the ward and see iron IV preparations getting the woman, pushing her into a very bad anaphylactic reaction, and we would make heaven and earth together to save them. And we would call our seniors and keep all the emergency drugs. But slowly I have observed there is more and more improvised over these iron preparations, from the iron dextran preparations to then iron sucrose, which is also made a good output or the contribution in the market. Then it has slowly come to what is called as now the carboxy maltase combinations, ferric, which we can give something like a good dose. That because before we used to give only 100 mg, 200 mg, very small doses, because we were so scared of the preparations because of the reaction. But now the ferric carboxy maltase FCM, which I am using because I am having a small setup of my own other than Fortis. Fortis corporate hospital, we have a lot of backup. We give IV very the drop of the hat. But here, when we give on our own in a clinic or something, we want nothing to happen to the patient. So ferric FCM preparations in a higher doses, just a small period of 15 to 30 minutes of time, we can give a bolus dose, and we can make our woman who is with hemoglobin of some 9 or something at 8th month of pregnancy,
Yeah.
she is about to deliver in another 1 month or so, or she may get into premature delivery because of the anemia. So we are just making her hemoglobin jump to 10,
Yeah.
and by another dose repeated up to 11. So we are more bold to deliver her with a very good health profile. So the IV preparations with least or zero side effects like FCM have really made a contribution. I am very happy with this preparation. Even though oral preparation some people are taking, that is on the other side, but these IV things have made a revolution. And the blood transfusion and the reactions of the blood transfusions and the disadvantages of the blood transfusion, everything is just in a stroke, it is swept by this IV preparations, I can say.
Absolutely correct, ma'am. That was a very good insight from you, because as you said that anemia should be promptly treated in all the patients.
Yes.
And of course, parenteral iron preparations play a huge role
Yes.
in preventing as well as treating anemia, especially
Because a
in women.
healthy mother, healthy baby.
Yes, absolutely correct, ma'am. And especially the role of ferric carboxymaltose, as you
Yes,
said,
yes,
not just for all the patients, and all the anemia patients can be treated very well with the
Very
IV,
well,
IV
yes,
preparations.
yes,
preparations.
yes.
And of course, as you said,
And
that
we are
the
very happy
protein.
it is available in our Indian market.
Absolutely
There are
correct,
some
ma'am.
3 types
Yeah.
of preparations, at least one preparation presently is being available.
Yeah.
And I think even though the cost, but the cost is something worth spending on these preparations.
Absolutely.
Because it gives something like a blood, one bottle of blood, how much it will, and
Yeah.
how much of reactions and the sufferings it will be associated.
Yeah.
That's one thing.
And as you said that the parenteral iron preparations are much safer than the blood
Safer, yeah.
transfusions that
Yeah.
we have. So
Yeah.
because of the adverse reactions
Correct.
or the safety
Yeah.
issues which can
Yes.
arise due to blood transfusions.
Correct.
So the patient should be put upon
Yes.
a parenteral iron preparations, preferably an FCM
Yes.
molecule as such, which is a
Yeah.
great molecule in treating anemia as such in women.
Yeah.
So thank you so much, and thank you for
And
the key insights.
these
over
days
here,
I would
ma'am.
like to
Yeah,
give a
ma'am.
message,
Yeah,
because
ma'am.
something like it is not for just fancy of recording I am doing. I am into Rotary camps also, and I am also into Karnataka Gynec Society South Coordinator. I am trying to arrange a small camps where these anemia patients can be brought and given in some 10, 20 like that in the future months.
Okay.
I hope like the support will
Sure.
be there from every wing. Thank
Sure.
you so much.
Thank you
for
so much
this
for giving
sharing.
the key insights
Yeah.
on the topic. Thank you so much for
Thank you so
being
much.
us with us. Thank you so much, ma'am.
Thank you.